Hello and welcome to Meaningful Mental Health. I am your host, Cheryl August. Today we will be taking a closer look into our assumptions and beliefs around mental health and substance use. This segment is about crisis intervention. We're going to the streets to see what people think about mental health and substance use. Going to you, Kat and Gustavo.
Thanks, Cheryl. We're here today, Thursday, beautiful day at the Marin County's Farmers Market in San Rafael, asking folks in the community questions about mental health and awareness. What would you like to see in Marin County as far as mental health resources that maybe we don't have?
Probably housing. I think that really does a lot to get people stabilized and, get in a place where they feel that they actually have some hope.
I'd like especially help with people who are living on the street or homeless that have a safety net where they feel that, when they're in trouble, they can have someone to go to.
We know we've opened a triage center here in Marin, Kaiser. It would be great if we had a center that had crisis management for the mind, for the heart, the soul, the aged, the disabled.
Everyone takes it differently, I believe. Everyone comes from a different background. Everyone deals with things differently, obviously, and not a lot of people have help, and some others are lucky to have help.
Well, I just hope I'll never be in that situation. I have worked in a mental hospital in New York, a state mental hospital, which was not particularly pleasant experience, but you realize how there's really not much difference between some of the people in there and the people on the outside, except that they had at one time somebody, maybe when they were going through a difficult time, we had somebody, a family member or a friend, who helped us through a difficult situation where they didn't, and they fell through the cracks and went down into a vicious cycle. So I don't know the answer.
I'd like to see a center maybe to allow people that have good hearts that don't have the knowledge to get the knowledge to help those that need it. So a crisis management center, I'm sure there are many, but if one focuses on the way society in this day and age with people in need, not just from a perspective of mental handicap, but need.
When you think of a mental health crisis, what do you generally think of?
Everybody just needs a TLC. That's all. The TLC goes a long way. If somebody take a minute to help somebody, God's work, and not expect money behind it, we would have a beautiful place.
Mental illness shouldn't be a stigma or alcoholism. It's just what people are going through, and we all are going through different emotions and feelings and really need support for that as a community.
As a social level of give back to your people, you give them back the things they need, not what you think they need. You find out, and this is a good way of finding out, and that's why you got me on camera.
It's time for people to really get help and intervention.
Great. Well, thank you very much.
You're welcome. Thank you.
Back to you, Cheryl.
We had a variety of responses out in the field. Let's see what our experts think. I would like you to meet Shannon Bynum and Suzanne Tavano. Today we'll be talking about their experiences in mental health and substance use crisis intervention. Shannon, would you please share with us your experiences about crisis, when that happened for you?
Well, I learned what a crisis was when I was in the military at the DMZ. I learned what isolation, loneliness is, and I found out my life expectancy was 9 minutes to live, and they told us we were expendable. So that was a shock.
That's a crisis, all right.
No, that's a crisis.
What happened after that?
How do young men deal with that? We deal with it by using substance to numb the feeling because we know, like you said, we're expendable. So life loses its value.
How did that play a role in your...
Substance abuse numbed the feeling. It gave you a sense of false reality because you lost hope. If anything was to happen, you already realized life was over.
How could things have happened differently?
Well, if things had happened differently, first of all, I would have listened to my parents. First of all, listen to the instructions and the directions instead of leaning to my own understanding.
Yeah. And what did using substances lead to?
Substance led to living a life of incarceration, and then incarceration where you're guaranteed to go in, but you're not guaranteed to come out.
Mm-hmm. So, were there resources in the Marin County Jail?
Well, yes, Marin County opened up a new wave. Cesar, he came into the county jail and he gave the men hope and inspiration with a fatherhood program where even though we were incarcerated, we could still be a factor inside the cells and at home. Because what he did was he gave us an opportunity to send books to our children. And the children got a present from a father that was incarcerated. And 20 years later, my sons never forgot that. And even though Dad wasn't there in the physical spirit, he was there in the spiritual. And that was a highlight of the Christmas, because they always talk about the book and they want more books.
Yeah, well, that's great.
Yeah, and what also he brought to the table was to show us what responsibility was. Because sometimes the demons we fight are within, and we start using the blame and the excuse game. And what they were teaching us to take responsibility as men. Even though we locked up, we can't change the past, but we can change the present and look to a better future.
Well, that is a great point. And let me ask you, are you engaged now in recovery in the community? How are you involved?
Well, first, I go to First Missionary Baptist Church. Then I'm also involved with the Fatherhood Program. And then on Mondays at the fire station at 7 o'clock, we do urban deliverance. And then on Thursday night at the fire station, we do celebrate recovery. And sometimes we do what we call interventions in the homes.
Can you tell me a little more about Celebrate Recovery?
Celebrate Recovery is we identify the problem and we use the spiritual steps. We go in, like they say, like an extracting team. We want to extract the pain and the hurt. First thing we have to do is face it. So the demons that we run from, the excuses, we have to face those. Also with the county came Centerpoint. Centerpoint was a great facility. It helped me get structure. It gave me principles. It gave me foundation. And it gave me the support for me to move from where I was to where I needed to be to where I'm trying to go. In urban development, we look at the underlying issues. Because all substance abuse and dysfunctional behavior is not just on top of the surface, it's the underlying issues. The reason why I can't function is because my dysfunctional behavior comes from something that I'm not willing to face. But it's good for me to try to blame and make excuses for.
And where would they go for services to face their problems?
Support groups are great.
Okay.
You cannot do it on your own. Spiritual support is great.
Okay.
Because it uncovers some depth. And like I said, Centerpoint was great. It gave me structure.
Would you be willing to share with the community watching, give them 3 messages, 3 points that were most meaningful to you in the stages of your recovery?
Well, the 3 steps, one was to identify the problem. And then the next one was to accept the truth. And then the third one is, how do I do that? The H is for honesty, the O is for open, and the W is for willingness. That's how you do it.
Thank you very much, Shannon.
You're very welcome.
It was just very inspirational and moving to hear
Thank you very
your
much.
recovery.
Thank you.
And now I'd like to welcome Suzanne Tavano. Tell us what your position in Marin County is.
So my current position is I'm the Director of Mental Health and Substance Use Services for Marin Health and Human Services. I'm a public health nurse and a clinical psychologist.
Suzanne, please share with us what systems are available for people who are going through a crisis?
We do have a whole array of services. There's a psychiatric emergency service at Bon Air. We have a mental health access line. There's a local North Bay suicide prevention line, a national suicide prevention hotline. As you know, the county is just getting ready to start mobile crisis units, which will be able to go out into the community and help respond in the community either without law enforcement or if law enforcement needs to be involved, but it's really to intervene out on the street and to avoid PES visits and avoid 5150s as much as possible. When we look at numbers, 70% of the people who come to psychiatric emergency services come in on an involuntary hold, a 5150 hold. But of all people, whether they're coming, of the 100% of people coming in, only 30% require hospitalization. So that means of all people coming to PES, the majority are coming in crisis and really needed to be connected back out to the community and a whole array of services and supports that are available. So I would say in a crisis, it's trying to identify it as soon as it starts happening. And I think a lot of times it's the people around you who notice it before you do yourself, and then what do you do from there. And so I think the importance of having a support community is there, and people tend to reach out first to those they're most comfortable with, whether it's friend, family, neighbors, community members. So I think that's a really important part of it. And then it sort of goes from there. And I think when outside entities become more involved is when it's really a matter of safety, either safety of the person, safety to the community, whether that person's really able to take care of themselves in the community or if they need more help.
Would you say that there are certain signs that would indicate that a person has mental health issues? Would that be a distinguishable sign from someone that has substance use issues?
Sure. And I think you just raised another very important point about stigma. And that's the other part of great value of Shannon telling his story, is that stigma really applies shame and guilt to people, and then people tend to internalize that and feel shame and guilt about themselves. So the outside community poses stigma, and then the person stigmatizes themselves. And all of that goes together to not wanting to acknowledge that something might be going on, and often leads to not reaching out and getting help when it's needed. So there are so many different crisis situations. I don't think we'll be able to cover them all. And there are crises that involve people becoming depressed and or suicidal. And then there are other crises where either because of a mental health condition or drug misuse, that psychosis will become evident, and then there are different responses for that. So I think it really depends on the particular situation and where the person is in terms of the crisis continuum, whether you can start with those that are near and dear to you and have enough support to intervene there, or if things have gotten to the point where it's going to take some outside help. And when it takes some outside help, I think it's when people are seen as a danger to themselves, a danger to others, just not being able to take care of themselves in terms of providing food, clothing, shelter. And oftentimes that's when law enforcement is called, 911 is called. People are really concerned about what's going on. And what I would say about that is if things get to that point and there's fear of someone being hurt significantly, whether it's the person or someone else, calling 911 is the appropriate step. But if you call 911, prepare yourself. Family members, neighbors, community members should prepare themselves, because when they make the call, they're going to be calling a dispatcher. And so you want to stay very calm. You want to stay very factual. If you can, you want to say you really don't think there's any risk of someone being injured, that there are no weapons present, et cetera, so that when the peace officer arrives, they come with a mindset of intervening in a supportive way, rather than arriving at the scene prepared for some very bad things to happen. So I think how you present yourself when you call 911 is very important in terms of how the person is treated at the time, and then sort of how things evolve. And then going to your initial question about if you're out on the street and you see something happening, what do you do?
Yeah.
And I think what each of us does probably initial is sort of on some level scope it out to see how safe it is to intervene. In most instances, it's safe to intervene. Mm-hmm. And whether it's intervening with someone who's potentially suicidal or someone who's having a panic attack, an anxiety attack, or experiencing some level of psychotic behavior and thinking, the important thing is if you are inclined and you feel safe and comfortable in doing it, because if you don't feel safe and if you don't feel comfortable, you probably shouldn't, because you're not going to be very helpful. You might get the person more upset. But if you are feeling like you can do something, then it's a matter of approaching in a very down-to-earth way, very calm, identify yourself, and ask the person, you know, what's going on? Do you need anything? Can I do anything to help you? And really take it from where they are. Do not have a blaming voice, don't have a critical voice, don't tell the person what needs to happen, but really try to engage in that way. If you suspect the person is at risk of suicide, it's really important that you stay with that person until someone else comes to help intervene.
I wonder if you're aware of that 9/11 brochure that kind of gives people a script. There it is. You do know about it. Of course, that is a really good guideline for effective communication.
It is. It really lays out a basic way to approach the situation.
Now, what happens if a resident of Marin County has a crisis in another county? Is it automatic that they can get transferred or back to Marin County where there are so many helpful services and agencies, or does that go through the justice system?
That is a very complicated, I have a complicated answer. I'll try to keep it as simple as possible. If the person has private insurance, the chances are we, the county, are not going to be notified. The chances are very high. If someone is a Medi-Cal beneficiary or has Medi-Cal and Medicare or is uninsured resident, it's then very likely that we're going to get a call to help coordinate care. The way the managed mental health Medi-Cal benefits are arranged in California is each county is responsible for managing all of the benefits for a Medi-Cal beneficiary in their county. So it goes by the county code. So if someone from Marin who has Medi-Cal is visiting in Alameda and a crisis occurs, the Alameda staff is going to call the Marin Access staff and explain the situation. If the person is temporarily residing there, then they may provide the services in the other county in coordination with Marin. If someone is either put on a 5150 involuntary detention hold and is taken to an emergency department or a PES, it's the same sort of dichotomy. If a person's privately insured, we don't know about it. If someone has our Medi-Cal or is uninsured, then we'll get a call and then we get involved in the care. So there are really two different systems of health delivery in this county, and I think that it really depends on which part you're speaking to. So
that leads me to, how do counties inform each other about what's going on with someone from a different county?
If they are Medi-Cal beneficiaries, uninsured, then we will get contacted because we help arrange the appropriate care and we're responsible for managing. So if the person's going to receive the care in the other county, then we do that coordination. If they are able and want to come back to this county, then we're going to arrange the services here. If someone is in another county and ends up being hospitalized, then that hospital in the other county will contact us usually within 24 hours and let us know so we can get involved in the discharge planning and the aftercare plan.
I see. How do you determine if a crisis someone's going through is due to mental health illness or disorder or condition? How does one distinguish what is the force that's creating this kind of behavior? Are there ways to discern?
Well, I think the general public has a very difficult time in discerning that. I think people with lived experience, whether it's on the substance use side or the mental health side, are probably pretty good at being able to determine what might be going on. I think in terms of the professionals that are rendering services, it's a matter of interacting with the person, observing the person. There are a variety of things that could be going on. It could be, the behavior could be related to a physical health problem, and then it's important to identify that and treat appropriately. It might be primarily substance use initiating that particular crisis, or it might be mental health particularly initiating that crisis. In terms of, so once you're sure that the physical health conditions have been evaluated and the person is physically stable, then determining what the interplay is between mental health and substance use is a matter of talking with the person, observing the person, vital signs if you're suspecting substance use in terms of blood pressure, pulse, etc. If it's very difficult to tell, it's not uncommon for a toxicology screen to be done so that if there are any chemicals present, that is known. But I think, again, if there are people close to that person that you can connect with, it's really important to hear from them, because people close usually know what's going on with the person, and that's really important information. And I should add, if someone is put on a 5150 in the community and taken to our psychiatric emergency service, there is a family partner available to reach out to the family members, important people, to lend support and get more information, etc.
In your experience, is there a different way that one would intervene with someone in a mental health crisis or in a substance use crisis? Is it a different intervention that you know of?
I would say, I'm going to speak in broad generalities here. If it is primarily a substance use crisis, there are more concerns about physical well-being, in that the possibility of death due to a physical health experience related to the substance use is much more common than would be with a mental health condition. If it seems that someone is overly intoxicated, then getting medical attention right away is very important. In terms of how you would behave, so if we put that to the side, how you would behave, it is still pretty much the same in terms of approaching calmly and just trying to understand what is going on with the person.
Okay, that's excellent, very helpful to know, because some of us do want to intervene and we feel able to intervene, but we're not sure what modality to use in order to develop some kind of rapport and get information that we need.
And this is it's a difficult part of the discussion, because psychoses can either be due to substances or they can be part of a mental illness. And what we would say psychotic behavior would look sometimes very similar. So I think people have a very hard time out on the street. If somebody's really agitated and aggressive and et cetera, the assumption usually is that it's due to a mental illness. Many times it's due to substance use, and particularly amphetamines.
What do you think are the most common barriers?
I think the starting point is what we were talking about a little bit earlier about stigma. And I think it's a very cultural thing. In some communities, in some cultures, people feel more comfortable saying they have substance use issues. In others, they feel more comfortable saying they have mental health issues.
True.
60% of the time, it's both.
60?
60% of the time,
it's both issues.
With serious mental illness, substance use is present also. So I think people sort of choose what they, within their culture, within their community, feel most comfortable with in identifying, but there's stigma to both. So whichever route you go, you're overcoming stigma. So that's part of it. The other is people oftentimes do not know where to go to get help. They don't know where to go within their community or at the county. And sometimes it's a difficult system to navigate. There are many different phone numbers, many different places you could call, and what's the right spot.
So would you say both internalized stigma and outside stigma prevent people from getting help? Many people think, I can do it on my own. It's up to me. I don't want to burden anyone else. And who is really out there to help?
That's absolutely true. And when we talk about crisis intervention, we really should back the conversation all the way up to prevention and early intervention and early identification. Because just as with any other conditions, the earlier something is identified and the earlier there's some appropriate intervention, the better the course is going to be over time.
And I wonder if parents are really frightened to have their loved one labeled if they get involved in the system. So if parents reach out and they already feel the pressure of, internalized stigma, and that they're afraid that their loved one is going to be classified in that way, and that it would be on record that they have a mental illness or a substance use issue.
I think it's actually a couple of things. I think one is we all tend to normalize the behavior of our family members and overlook it in many ways. When you hear statistics about when people are diagnosed with a serious mental illness, what's the age range, and usually it's late adolescence into adulthood.
Right.
But when you talk to family members, they saw things when children are 5 and 6, but not so far out, but something. But it's sort of, you normalize when it's within your own family. So I think that is a part of it in terms of early identification. And then the other is stigma, not only for the person that is needing help, but the stigma that the family members then experience, because it's sort of like the disgrace and shame of the involved person is extended to the family as well, and it's very difficult for family members to talk about the same issues for the same reasons. You start feeling like you're an outcast.
And yes, and the fear of going through that kind of initiation. And what early warning signs should a family look for?
It would be different for different situations, but I think you just look for changes. Changes in sleeping, changes in eating, changes in socializing, changes in energy level, changes in being engaged in school or work or community activities. It's when things start changing. Those things are the sort of the obvious things, the way that the internal changes are being manifested.
So they could become more secretive or be out more than usual, and
it could be. And then and it's really important to distinguish children from adults. So depression is a really easy one to talk about in that respect. In that depression in adults, usually you think of the person as having a depressed mood. They're sad, they might be tearful, they're withdrawn, they're quiet. With children and adolescents, a lot of times it's the opposite. It's almost an attempt to outrun those feelings. So there's agitation, acting out. It's almost the opposite at times of what you see in adults, and family members don't always make that connection.
What happens after an individual has gone through a mental health or substance use crisis in order to stabilize or to help them enter into the recovery stage? Where do they go for that kind of help?
It's important to get involved, to be part of your recovery, to take action. People aren't going to do it for you. It's you, right? And being back a member of the community and contributing to the community is a really important of recovery and sustaining recovery.
And I can just say, and I love what you've been saying. Trust. Trust is a hard thing, because when trust is broken, it takes a while to build.
Absolutely.
Yeah.
And many people feel more comfortable getting, short of emergency help, getting help from family members, from the community and the faith community. And I think for, large sections of the community, the faith community, what the church does is really important. The spiritual part is very important to a number of people in recovery, whether it's substance use or mental health.
And I just want to say, when you said about the spiritual aspect, some of the best work is done through the spiritual leaders to go in to extract the hurt and pain, because it's not really good to send officials in when a murder or something like that tensions are high,
Yeah.
and people tend to respect the person that's in a spiritual capacity because I'm more open to hear from you because you have compassion.
Yeah.
You can feel my pain.
Mm-hmm.
It's not like you just coming up with that old blank stare. You know, I need some kind of compassion and understanding.
Absolutely.
And the community gives that also now with community involvement because that can work also to assist in mental health issues.
But I wonder what happens, what support is available for an individual who doesn't quite meet the standards. Like I know there's a care team that goes out and looks for people who are living under a bridge or don't have, are homeless and don't have any funds and also have a mental illness. But there are people, I wonder, who fall through the cracks.
It's been a long-standing gap. And the gap is not to be overly technical, but the county operates what's called specialty mental health services. So that means the state gives us a list of diagnoses that we can treat. And then in addition to the diagnoses, and this is where it's hard to have the conversation because I really come from a wellness and recovery orientation, but Medi-Cal and the regulations come from an illness model, so I go back and forth in my language, which is at times kind of strange. But the state provides us with a list of diagnoses and then how difficult it is for the person to function in different areas of their life. So they have to meet these medical necessity criteria to receive what's called specialty mental health services from the county. So historically, people that are more in that middle ground were not really having access to services. I think people don't know, they just assume the county didn't want to serve them, but it was really by state regulation. However, the Affordable Care Act, which we're very appreciative of, actually has started to address that. So they have added benefits for mild to moderate mental health needs, and those are administered through the health plan, through Partnership Health.
I see.
And I think many people who are Medi-Cal beneficiaries receive their physical health from the federally qualified health centers. So the Marin City Wellness Center, Marin Community Clinics, Coastal Health Alliance, Ritter, are FQHCs. They now all have behavioral health professionals who are part of their staff. So that's a whole new level of care that was not available before. So people should take advantage of it. If people feel like they need something but they don't know what, and they're not seeing mental health professionals, talk to their primary care provider, talk to their nurse practitioner, talk to their pediatrician, and just say what's going on and then get connected to the right level of support services. If I might add to that, though, because I think it's going back to what Shannon said also, people want services that make sense to them. And so that means they need to be provided in the right language, and they need to be consistent with the culture of that community and the values of the community. And I think that's an area that we're all continuing to work on, because people will accept what they feel helps them. They don't want to accept something they don't feel helps them. And that's really our job, is better understanding that.
If you have any last 3 takeaway points.
Know the signs, reach out.
Reach out.
Come up with your recovery plan. And your recovery plan may include professionals, may not include professionals, but definitely I think involves the community that you're part of and how you can feel meaningful in your life.
What can we expect in terms of future, the future of mental health and substance use services in Marin County?
The new programs that are about to come up are the mobile crisis, the triage.
Great.
Also, we're starting an outreach and engagement team for people that have been, not so inclined to come in and get services, so we could start reaching out more into the community. So those are coming up this year. Keep you posted.
Thank you.
All right.
Thank you, Shannon Bynum and Suzanne Tavano. We thank you very much for watching.